One of Central Indiana's major health care providers is telling News 8 how it plans to handle Indiana's new abortion laws.
The near total ban goes into effect in 1 month. News 8's Hannah Mordeau reached out to all of the major hospital networks in Central Indiana for this story. What'd you find, Hannah?
I did, and most said they couldn't comment on specifics yet. They're still trying to understand the law, but Community Health Network is speaking out. It says when the abortion ban starts, their doctors will follow the law, but women will still get the same prenatal, contraception, and miscarriage care that they've always had. And when it comes to abortions, the hospital system plans to help women find the care they need or want.
We will always take care of women.
Dr. Indy Lane has been an OBGYN at Community Health Network for 18 years, but this is a first.
A lot of women were concerned.
Indiana's near total abortion ban, starting on September 15th, has her patients wondering what next.
Can you answer that? What does it mean?
Their care is not going to change. Thankfully, we'll continue to be able to provide contraception, sterilization for those women. And I think that the vast majority of services we provide for miscarriage will continue to go on as they always have.
The hospital system never did elective abortions before, but has always advised women on where to go if they need or want to terminate a pregnancy, and plan to still do that.
There will be resources. We know that women cannot seek elective pregnancy termination in Indiana, but we're not forbidden in terms of giving those patients the resources that they may need or seek outside of Indiana so that they could get safe care.
They're also analyzing the exceptions to the new law. Abortions are allowed in cases of rape and incest up to 10 weeks post-fertilization, if a fetus is diagnosed with a lethal anomaly, and to protect the life and physical health of the mother.
For instance, if a woman is diagnosed with cancer and she needs chemotherapy, providing chemotherapy to the patient will be deleterious to the fetus. However, not proceeding with therapy can impact the woman's life.
Fatal fetal abnormalities. What is that?
So it varies, and I think that there's still some discovery, some work that needs to be done, certainly at Community Health Network, to understand what exactly we define as a lethal anomaly, because there are some gray areas.
Next, to any confusion surrounding miscarriages.
Miscarriage, not the same as abortion. Can you clarify the two?
Correct. So a miscarriage from a medical perspective is when you have a pregnancy where fetal growth has ceased or there is no fetal cardiac activity. When you look at the technical term, the medical term, it's also sometimes diagnosed as a missed abortion. And I think that's where a lot of confusion comes in. Although it's called a missed abortion, we'll still be able to take care of those women that experience a miscarriage, meaning their pregnancy has terminated for reasons that we don't always know.
For a miscarriage, women will still be able to get a surgical D&C to remove any remaining fetal tissue or take an oral medication like Cytotec and misoprostol to do the same thing.
Same medication that one might use for an abortion. Is there any concern that that'll be investigated?
Right. I think that we're still doing discovery on, how that medication can be used. Again, we've only used it for miscarriage, and it's highly regulated in terms of, it has to be dispensed in the office. You have to have the patient take it in front of you, and it has to be when we know that it is no longer a viable pregnancy.
Community Health Network says it has not come to any conclusion about if it will perform these exception abortions in the future. But what they do know is their doctors plan to help women the best they can.
So we are concerned about an increase in women coming to our organization that perhaps have not gotten the best care, but we will absolutely take care of those women and provide them with compassionate, non-judgmental care.
And under the new law, abortions can only be performed in hospitals or outpatient centers owned by hospitals, meaning all abortion clinics could lose their licenses. Dr. Lane says these clinics are crucial to helping women get contraception or Plan B, and she hopes they stay open for that. Back to you.
Hannah, thank you.